All right. Ooh. Maybe down a little.
Yeah, right.
We're definitely on. Good. Well, good morning, everybody. How are you all doing? Good. How many people have questions about whether hormones are good or bad? Okay, good. How many people think hormones are dangerous? Okay, good. All right, well, maybe if you change your mind. So the name of this talk is Hormone Myths versus Reality. And I'm going to go through first what hormones do. And I know you were here last time, and so maybe some repeat for you. But for the rest of you that weren't, I'm going to go through what hormones are and what they do for us so that you understand why they're important. And then we'll talk about the controversy. So, number one, hormones are messengers, and they carry information from one part of our body to another. Some hormones are made in the brain, and they govern our glands, which are things like our thyroid gland, adrenal gland, ovaries in women, testicles in men, and so that your brain sends out messages to these various glands to tell them to do certain things. Your glands then make chemicals that are also called hormones that go out to all of your different tissues. So, for example, for thyroid, every cell in your body gets a message from thyroid hormone about how fast to function. It's kind of like your thermostat. Whether to go faster, whether to go slower, whether to make certain proteins, whether to stop making certain proteins. So these messengers take these really important messages to virtually every cell in your body. And like I said, they control reproduction, so your brain tells your ovaries when to make certain hormones that, if you're in your reproductive part of your lifespan, will prepare your uterus to receive a pregnancy. It governs your immunity, so how well you fight infection, what your risk of cancer or other diseases are, has to do with the health of your immune system, part of which is hormonal. They regulate salt and water balance. So whether you get puffy and retained water, and there are certain hormonal problems where people don't retain enough water, retain too much water, that's under hormonal control. Our metabolism, I already mentioned. Also governs our body temperature. It governs aging, the speed at which you age. It governs brain function, so there are a lot of things that hormones do. Here's our thermostat. And they make a difference in whether you're happy or not, because if you have enough energy and your mood is good, and if you're in a relationship and sex is important and your libido is good, all of those things end up making you happier. If you have the energy and initiative and wherewithal to do the things you want to do in life. Hormones are involved, like I said, in our interest in sex, our sexual function, and how attached we want to be to somebody. There are hormones that get released when we hug somebody, oxytocin, so hormones are involved in everything about human interaction. And then as far as our brains go, I'll tell you a little more later, but hormones are involved in, for estrogen for women, in memory and cognition, and for testosterone, the same thing in terms of cognition. Also, definitely mood is affected by your hormones, and I'll talk to you a little bit about that when we talk about the menstrual cycle. How easily you can burn fat, how well you can build muscle, all the things that you work on when you're at the gym in terms of strength, endurance, and your body composition. They're under your control with lifestyle and exercise, but they're also under hormonal control. And all the things that we think of, so many things that we think of that are aging changes are in fact hormone changes. So even skin wrinkling, they've done studies, and women who are on estrogen in menopause don't look as old as women who are not on estrogen.
Yeah.
Because your skin doesn't wrinkle as much. And so they've actually done studies where they take photos of women and they have plastic surgeons who, you know, are skilled at evaluating people, and they guess the women's ages. And they guess, you know, at least a few years younger for the women who are on estrogen. And that has to do with your skin tone and the support underneath your surface of your skin that happens due to estrogen. So it can affect, and it affects the more important things about aging in terms of, you know, cardiovascular disease, cognitive decline, osteoporosis. All of those things are a lot under hormonal control. And so what happens during our life cycle is that we are really hormonally optimal, or we should be, when we're about 25 to 30 years old. Now, I see a lot of young people who are very hormonally unbalanced, and I think that has a lot to do with stress, environmental toxins, a food supply that's not very good unless you really work on getting eating organic and, you know, getting food at the farmer's market, which is grown close to, you know, where you're buying it, all of those things. But it's harder and harder for young people to stay healthy. And I think it has to do with all those various factors. But we are supposed to be hormonally optimized at age 25 to 30. And then things start going downhill. And so some of our hormones, even by age 45, have significantly declined. And it does things like make us not feel as vital, not have as much energy, not have as much endurance. And for some women, you know, a lot varies with the menstrual cycle, and you can see the ups and downs on the chart here. Let's see, estrogen is in orange, progesterone is in green, and with changes, some women notice their mood changes during their menstrual cycle. Some women are very sensitive and their cognition changes during their menstrual cycle. Certainly PMS and emotional irritability have to do with hormone changes with the menstrual cycle. So we know that hormone levels will very much affect our moods. Yes. And then this is a chart that shows you hormone changes throughout life. So you can see on the left-hand side of the chart, it's very low before the onset of menstrual period. And then in the teens, it gets pretty erratic until regular menstrual cycling is established. And, you know, a lot of you may remember when you were teenagers, your periods were really irregular. And then later on in life, they tend to get more regularized, and they stay regularized until you get to peri-menopause, which actually starts at age 35. And then you can see on the right-hand side, things get really erratic again until you are in menopause, and then your hormones are low, but they're stable. And some people do better when their hormones are stable, even if they're at very low levels, and other women feel worse when they're low. So it varies a lot from person to person.
So
some people.
Can I preface this part? This is like a scary movie. It's going to get really scary right now. I'm going to tell you the ending. It's a good ending. So just bear with it. First time she went through this, I was like, wah, wah. So, hang on. The scary part's going to end in a minute. Let's go. Bring it, Dr. Sklar. Bring it.
So, and some women notice they feel, for example, when your hormone levels are super high during pregnancy, some women feel fantastic, other people feel horrible. And so you can see the differences in how it's very individual. And these are some slides about cognition, which I've been focused a lot lately on cognition and hormones. And it turns out women without estrogen don't do as well on tests of cognition. So this was a study about women who having hysterectomies. If you have had a hysterectomy before menopause and you had your ovaries removed, it's been found that brain speed is decreased by 15% from losing your ovaries. So estrogen is really important. And then studies have been done on women who are on estrogen and off of estrogen in menopause, and the women on estrogen do better as far as cognition testing. So perimenopause says it lasts 2 to 5 years. That's kind of classically what's in the books. But like I said, it really starts at age 35. And one of the injustices that are done to women in their mid and late 30s who go into their doctors and say, you know, my periods are getting erratic and I don't feel like myself and things are changing, is you're told, you're too young for menopause, you know, like come back in 10 years. And there really are changes going on. So it's not recognized officially as perimenopause, but I can tell you the changes start a lot earlier than the medical system gives credit for. Average age of menopause is age 51. That's the average in our population in the United States. And the changes can go on for 15 years before that. It's just a long time, and it's a long time to suffer from things, and you don't have to. So these are the things that I commonly see as changes, not just menopause, but during this perimenopause time. Problems like lower interest in sex, less energy, sleep not so good, emotional swings, feeling depressed or anxious, having brain fog, not feeling as strong, and even if your weight doesn't change, having this shape shifting where you have more body fat and less muscle, so you notice like your pants don't fit as well even though maybe your weight really hasn't changed, and a lot of those are hormone changes. This is another one on estrogen and memory. So premenopausal and perimenopausal women perform a lot better on memory tests than postmenopausal women, and that has to do with having estrogen available. And the fact that women who are on estrogen are half as likely to develop Alzheimer's disease. So in terms of trying to figure out your risk-benefit analysis, what you want to listen to or what are the benefits of hormones, and then figure out what the risks are. So what happens with menopause? There can be premature aging, increased risk of dementia, more body fat, more inflammation, bone thinning. And for women it's called menopause, and men don't have that abrupt change in their hormones like we do, you know, or like periods stop and we have this definite, obvious sign that an era has changed or transitioned. But men do tend to get decreasing testosterone levels with age. And it's been called andropause. The medical name is andropause. We sometimes call it menopause. There's something called grouchy old man syndrome because their testosterone levels go down and it makes them more irritable and angry. So some of the irritability that men have, just like, you know, women tend to get more depressed and anxious, men get more irritable and angry for the most part. Some of that is hormonal, so you can do something about it. You know, it's a shame to live with it. So starting at age 30, men do go through changes. They start losing anywhere from 1 to 3% of their testosterone levels each year. And a certain small percent of men already in their 20s have low testosterone. And this shows men at 30 plus, as many as 20 to 30% of them have low testosterone. And then by age 60, half of men have low testosterone. And it affects their well-being in a lot of ways. Diminished energy, diminished endurance, diminished athletic performance, less muscle mass, less good sexual functioning and libido, foggy thinking, a lot of things that happen with women. Mood, cognition, energy.
So if your husband gives you a hard time, you just say right back at you, buddy. You're the
Still buying it.
That's right.
Oh, Steve's here.
Yeah.
He has
You want to leave or are you okay staying? All right. testosterone for men has been correlated with increased chance of Alzheimer's disease. And we know that giving testosterone to men can enhance their memory. And some of the testosterone, both in men and women, get converted into estrogen. And some of the benefits of testosterone for men may be that small amount of estrogen that gets produced. And we think that may improve brain function as well as cardiovascular health, because estrogen is good for your blood vessels, good for your arteries.
Does it matter how they get the testosterone, like if it's in pill form or?
We'll talk about that, yeah. So, and again, the risk of going through these hormone changes, same as for women, premature aging, increased chance of dementia, higher chance of cardiovascular death, inflammation, body fat, and bone thinning, just like for women. So, you can see some of the benefits of hormones, and you can see some of the dangers of hormone decline. And so the real issue comes, what about replacing hormones? Is that an okay thing to do? And one of the problems is that most people, and it includes doctors, get our information from the media. And so newspapers, TV, magazines, and how do they decide what they're gonna print? They print what sells. Good news doesn't sell. So you rarely read an article about the benefits of estrogen or the benefits of testosterone. Hearing about horror stories, that sells. So just about every time an article has come out in the last 17 years about estrogen, it's been based on a flawed study called the Women's Health Initiative. So even as recently as 6 months ago, there was an article that came out about some problem with estrogen. And I said to myself, please don't tell me they're still evaluating the Women's Health Initiative. And sure enough, it was. So just about everything you read in the newspaper that's bad news about estrogen goes back to this study that was poorly conceived, poorly done, and the take-home message is you don't take it the way they gave it. The other thing that we have going on is big pharma wanting to make money. So a lot what's best for you is not what gets promoted. So I hate to tell you, but a lot of what supposedly is being done in the interest of your health is in the interest of somebody's pocketbook, not in the interest of your health. If we were really doing things in the interest of your health, we would be having huge lifestyle classes, everybody would have access to gyms, gym owners would get reimbursed by insurance companies.
We save lives.
What?
We save lives.
Yes. Exactly. We would be, some insurance companies do give a break for people that, show that they're proactive about their health, but we would have a completely different model. We would have a wellness model, not a sickness model. So that's what it would look like if we were truly interested in promoting health and not somebody's pocketbook. So given that this is the current system, it's always a matter of teasing out really what is reality, what is the truth, and what is not just lining someone's pocketbook. So the Women's Health Initiative was a study set up by the National Institutes of Health. Now it was heavily promoted by Wyeth, which is a pharmaceutical company that makes Premarin. And they were sure, based on the results of a number of what are called observational studies, when you don't have a group that's on the hormone and a group that's off the hormone, but you just kind of you look at thousands of people and say, wow, the people who are on estrogen don't have as many deaths as the people off of estrogen. And so it looked like hormones were beneficial, and they decided they wanted to have a real study which compared hormones to placebo. So, a really well set up study. So they, let's see, which one is this? Yeah. So the results of the Women's Health Initiative came out in 2002, and that's why I'm mentioning it to you, that it's been 17 years, and there are still newspaper stories based on the results of the Women's Health Initiative, all of which results need to be completely thrown out. And this is, this was a whole other issue because for men, low T or low testosterone centers really promote testosterone for men. And I think testosterone for men, for many men, is a good idea. This particular center says your replacement therapy is performed in a comfortable atmosphere, not a stuffy doctor's office. And that is the wrong approach to hormones. You don't want somebody just giving you hormones. You want somebody evaluating your health and wellness. So hormones are part of it, but there are a lot of other things that are important. So again, you have to sort out kind of the money-making parts of things from what really is the proper way to do things. So what happened with the Women's Health Initiative? They picked the wrong women. So the average age of women in the Women's Health Initiative was age 65, women who had never been on hormones. What was wrong with picking that age group? There's nothing wrong with putting 65-year-olds on hormones, but the fact was they already had some cardiovascular disease, most likely. They already had some plaque in their arteries. And what happened was they gave the wrong route of administration. They gave an oral estrogen called Premarin. And when you give somebody estrogen in pill form, just like birth control pills, what happens? It increases your clotting. And when you increase your clotting, what happens? You get more pulmonary emboli, you get more blood clots in your veins, you get more heart attacks, and you get more strokes. So the take-home message is not to stop using hormones, it's don't give it in pill form. There are safe ways to give estrogen that don't do that. So they gave the wrong route, and they gave the wrong estrogen. And I'll show you a picture. They gave horse estrogen, and they gave the wrong progesterone. And it wasn't real progesterone. It's called a progestin, and it's synthetic, and causes breast cancer. So the take-home message is not hormones are dangerous, they cause breast cancer, heart attacks, and strokes. The take-home is don't use this stuff, use the safe stuff. So Premarin got its name from pregnant mare's urine. And it's really, a study in animal cruelty of lining up all these horses, collecting their urine, taking the sediment, processing it, and putting it into pills for humans. It has horse estrogen in it, which is different than human estrogen. And so Premarin used to cause a lot more side effects than other forms, natural forms of estrogen that our bodies make. Breast swelling and tenderness, bloating, water retention. And it contains dangerous forms of estrogen, which might be breast cancer promoting. And it's bioidentical for horses, not for humans. And when we say bioidentical, we mean chemically the same as what your body makes. And we have estrogen that's exactly like what your body makes. And it does not have these risks if it's given properly. And that's a picture of it. And it is protective, it's brain enhancing, and it does not have the risks if it's given in a topical, like a gel or a cream or a spray or a patch that a pill has. And this is a comparison of a bioidentical topical estrogen compared to Premarin. And you can see on each of the points what the comparison is. So if you use estrogen in a patch, I use a patch, other people use creams, there's no increased risk of clotting. With Premarin there is. It actually protects against heart attacks and strokes by reducing inflammation in your blood vessels, and you all probably aware of inflammation as the underlying cause of all chronic illnesses, whether it's heart attacks, strokes, cancer, or Alzheimer's. It's inflammation, and estrogen helps to lower inflammation in the blood vessels. It also helps to keep the lining of the arteries more flexible and improve the health of the linings of the arteries, so less likely to lay down plaque. Premarin, because it was in pill form and it increased clotting factors, increased strokes and increased heart attacks. And the bioidentical form of estrogen actually prevents Alzheimer's disease. We use it to treat Alzheimer's disease. And what happened with the Women's Health Initiative is they saw an increased risk of dementia, which they interpreted to mean Alzheimer's disease due to Premarin and Provera. It wasn't Alzheimer's, it was dementia due to mini strokes. It's another reason why people get dementia, but it's different from Alzheimer's disease. So estrogen, if it's given improperly, can cause dementia by causing mini strokes. So you don't want to give Premarin, you don't want to take it in pill form, and you don't want people to get mini strokes. And let's see, and one of the natural forms of estrogen, and we use it in our hormone replacement, is called estriol, and it is a form of estrogen that actually protects against breast cancer and lowers the chance that cells can turn cancerous. When they checked Premarin, and they had part of the study looked at women who were only on Premarin, not on any progestin, and in fact, it didn't seem to correlate with increased risk of breast cancer. So Premarin by itself does not increase breast cancer risk, but you don't want to take it because of the increased stroke, heart attack, blood clot risks. And then this is Provera, and I've given this talk to a number of groups, and some women are still being given Premarin and Provera. I know that Kaiser does, and then somebody from Kaiser yelled at me and said Kaiser doesn't make you use those forms, but in fact, you get them as part of your premium if you use Premarin and Provera. If you want a different form, you have to pay out of pocket for it.
Well,
So,
the premium so they can off you sooner and they pay less for you.
right.
You know what, I'm gonna say this, Dr. Sklar will say it, but if your doctor has prescribed you the pill form, I think it's time to leave your doctor, because he's dumb, right? He's not doing research, sorry. I just think it's the
Or
research
she,
is out
yeah.
there, or she is not paying attention and she's not updating her certs and her license like she should be. So just, I'm gonna put it out there because she won't. Leave that doctor, save your life. Okay.
Yeah.
Well,
Well,
I'm
one thing,
passionate about that.
yeah.
It
Well,
has
one
to be
thing we
explained.
know about new medical information, this isn't new, right? It's 17 years old. It takes 17 years for something new to get generally accepted and kind of used as common knowledge in the medical profession. Very slow to uptake new information. So this has been going on the last 17 years, and most doctors will give you their hormone recommendations based on this. They haven't updated in 17 years.
That's bad.
It's not good. And yeah,
Is it just this form, like is it just Provera, or is it other forms of, like the Nexplanon and things like that that are still, I guess, putting it in like, not like in a patch or something, or a cream?
I think you need to explain what happens in the liver.
right. And what is the Esplanade?
Nexplanon is the implant in the arm.
Right. So I'm not exactly sure what's in that one. I don't know if that's a form of Provera or not.
I don't know, I just know it's.
I know Norplant, but I don't know that one.
Okay.
Yeah. Well, what Amanda's referring to is that in terms of estrogen, when you take something by mouth, it goes into your digestive system and it gets processed through your liver before it goes into your bloodstream. And it's during that liver processing that you induce clotting factors. So if you use something in a patch form, you never swallow it, it never goes through your liver, except ultimately to get broken down. It does not have what we call that first pass that induces clotting factors. So that's the reason why a topical skin form or a vaginal form of estrogen will not induce clotting factors. Provera is a synthetic progesterone, and you have to realize that a lot of these compounds have been known, the bioidentical forms have been known for years, but you can't patent a natural substance. So you can't patent progesterone, you can't patent estradiol. So in order to have something where you could get market share, you had to have a patented product, and that's where using a lot of synthetic products came in. Before prednisone, we had pregnenolone, and pregnenolone's a great anti-inflammatory and doesn't have a lot of the side effects of prednisone, you can't patent pregnenolone. And so they came up with a synthetic form, which is prednisone, which if anyone's been on prednisone, you know it has a ton of side effects. And the same thing applies to progesterone. So there is a commercial form of progesterone, and how they got it patented, they put it in a peanut oil matrix. So they didn't really patent progesterone, they patent their delivery system. And the same thing goes with patches that are available commercially, they patent the delivery system. And so what ended up happening is somebody came up with a synthetic progesterone because they wanted something they could patent and get market share, and they came up with Provera. And Provera has some similarities to natural progesterone, but then it has a few chemical differences, and those chemical differences make all the difference. And so women on Provera, first of all, tend to have a lot of side effects like irritability that we don't see with natural progesterone, which is very brain calming, helps your mental focus, helps your mood. That doesn't happen with Provera. And Provera actually has anti-progesterone effects, and you want progesterone because progesterone is good for your brain, your bones, your mood, and it has anti-cancer properties. And Provera is cancer causing, and I'll show you a graph in a minute. So this is a picture of bioidentical progesterone, and Provera looks similar, but it has some other side groups sticking off the side. And this is a side-by-side comparison of progesterone and Provera. So progesterone is something that inhibits breast cancer cell growth, and Provera stimulates it. So the women who were on Provera had a 30% increased risk of breast cancer. That's really significant. So you've gotta be on a safe form of estrogen so that you don't increase your risk of breast cancer. What else? And when progesterone was combined with a bioidentical estrogen, a little misspelling, there was no increased risk of breast cancer, but there was with Provera. And I talked about heart attack and stroke prevention. And diabetes risk. So Provera increases your diabetes risk, which of course is not good for your long-term health. Statin drugs do too. So if any doctors are trying to get you on a statin medication, chances are you don't need it. If they don't do anything for women, and they increase risk of diabetes. So Provera increases risk of diabetes, which then increases your risk of cardiovascular disease. So you really don't want to be on Provera, and some doctors are still giving it. So be very careful. Yeah.
So is Prometrium acceptable?
Prometrium is the commercial form of bioidentical progesterone. So that's fine. Yeah. And sometimes it's just called progesterone. They'll give you a generic, or they'll call it Prometrium, which is, that was the company that put it in a peanut oil matrix so that they could patent the delivery system. But it is bioidentical progesterone, and it's fine unless you have peanut allergies. So. And then this shows you the binding capacities and what it means for the different things I told you about. So there are two types of estrogen receptors. There are, well, two main types, estrogen alpha and estrogen receptor beta. And estrogen receptor alpha is like putting your foot on the accelerator as far as growth of cancer cells, breast cancer cells. And estrogen receptor beta is like putting the brakes on. And so you can look at these different components. So estrone has 5 times the activity in terms of accelerating breast cancer growth as in stopping it. And the sperm in the horse's urine has a lot of estrone-like products in it. It turned out it actually didn't increase breast cancer risk, but we're concerned because it has so many products that are like estrone. Estradiol, so we women, humans have 3 types of estrogen. Estrone is one of them. Estradiol is our most potent estrogen. It's what really keeps our brains, hearts, bones, skin healthy. And it has one-to-one in terms of promoting breast cancer or slowing it down. It really does not have an effect on breast cancer. Estriol, on the other hand, is protective, and so it has more of the putting the brakes on breast cell cancer growth than it does on promoting. Let me just finish going through this. Premarin has a strong accelerator and a weak brake, so promoting breast cancer, and so does Provera, increases the growth of breast cancer cells and doesn't do much to stop them, as opposed to regular progesterone, which decreases breast cancer cell growth and puts the brakes on any growth. Yeah.
So the estradiol is okay to take in the pill form as the estrogen?
You don't want to take any estrogen in pill form.
Okay, so the estradiol, is that the estrogen?
All three of these are estrogen. Estrone, estradiol, and estriol are all estrogen.
And you're not
You
supposed
don't
to
want to take any of them in pill form. You're in a bind if you need contraception and you're on an oral contraceptive. I mean, but we're talking about other uses of estrogen. And so people who need contraception, and there are other forms of contraception besides the pill, but it's pretty well known that the birth control pill induces blood clots. It's rare, and a lot because it's given to younger women. We don't see as much blood clots and problems with pulmonary embolism and things like that as we would in an older group of women.
Well, I take the estradiol in the pill form.
Mhm.
It's like 1 milligram.
Right.
Time changes.
You should not be in a pill form,
Time
even if it's
changes.
estradiol. Yeah, even if it's the bioidentical one, it should be topical.
Felicia,
Yeah.
to the doctor.
And well, this is from a talk that I give about hormones in the brain. And for a long time, when they looked at estrogen effects in women's cognitive function, most of the time estrogen showed benefits, but a significant amount of the time it didn't, and people were not able to figure out exactly why. But in mice, they consistently show a benefit from estrogen. And they put mice in these mazes, and then they have to figure their way out, and how long it takes them to figure their way out. You can judge their cognition. Well, it turns out mice are always given the bioidentical forms of hormones. They also have estradiol because they're mammals. And that's why the studies routinely show that cognition was, benefited by being on estradiol. A lot of the studies in women were with Premarin or other forms of estrogen, and those don't work as well, and they may not work at all. And so my takeaway was that rats get better treatment than women in a lot of cases.
Yep.
So, and then addressing testosterone, because that's an issue for men, and people have concerns about prostatic cancer and testosterone, and that has also come from, I wouldn't say so much a drive for money, but a lot of misinformation historically. And so ultimately what more recent studies have shown is there's no relation between testosterone levels, measuring testosterone levels in blood, and risk of prostate cancer. So if you have higher testosterone, you're not at increased risk of prostate cancer. There's no relation between using testosterone, because people say, okay, well that's somebody's natural testosterone levels. What happens when you give men testosterone? No relation between giving testosterone and prostate cancer risk. So all of what's gone on historically has been a lot of misinterpretation of very old data from the 1940s. And people are always worried in men that have had prostate cancer, is it okay for them to take testosterone? And a lot of doctors won't give it. But it really depends on whether the doctor's up to date on things or not, because it's been found that giving testosterone after prostate cancer does not increase the risk of recurrence. Another misnomer was that testosterone causes cardiovascular disease. That's not true either. And it may even help with certain forms of heart disease called congestive heart failure, which is when your heart gets dilated and the muscle doesn't work well. So a lot of what here to show you, but this is a compilation of a lot of scientific studies that show that testosterone is safe. So in terms of, you know, what you're going to do about your situation, and this is always the question in anti-aging medicine, is, you know, people say, well, it's not natural to take hormones, like, you know, I'm just going to let nature take its course. And, you know, when you look at the comparison of, say, with diabetes, right, you're giving people insulin, and that's a hormone, and you can let nature take its course, and diabetics would die because they need the insulin. People die, it's estimated that there were 50,000 unnecessary deaths per year when the Women's Health Initiative came out, and women wholesale went off their hormones. There was a famous OBGYN that did a statistical analysis of how many deaths are prevented by being on estrogen and what it meant that so many millions of women went off their estrogen. And so you don't think about the lives that are saved, the brains that are saved by being on hormones. Mainly, like I said, you hear the bad press, and that's kind of what sticks in your mind. The more that we've worked with people with cognitive decline, early Alzheimer's, and the more I read about the benefits of hormones in keeping your brain healthy. And it turns out, you know, as people are aging, this is like one of the probably the number one concern, because who wants to, you know, live if you don't have your brain working? So we have what we call active management of aging, or successful aging, to slow down the aging process. And like I said, hormones are a piece of it. Lifestyle is so important. Avoiding toxins, exercising, eating well, eliminating refined carbs, getting enough sleep, meditating and reducing stress. So it's not all hormones, but it's hormones as part of an overall plan. And I feel like, we have a lot of spelling errors and problems here, but anyhow, I feel like your health is a three-legged stool. So there's the physiology, chemistry, you know, biology part of it, there's the lifestyle part of it, and then there's the mental, emotional, and spiritual part of it. And all of those have to be addressed to really be healthy. These are the hormones that we use in our hormone restoration program, not on everybody, but on most people, because most people need them, they're low in them. Pregnenolone is an important hormone that diminishes with age, and it, like I said, is very anti-inflammatory, but it also functions as a neurotransmitter in the brain, in the memory part of the brain. So being on pregnenolone helps to maintain your memory. Thyroid, I mentioned, you know, it just affects everything across the board in terms of the speed at which all the chemical processes happen in your body. I mean, when your thyroid is sluggish, your brain gets slowed down, your protein synthesis gets slowed down, people get brittle nails, dry hair, dry skin, constipation, low energy. All those things are like, you know, somebody's turned the thermostat way down. DHEA is another really important energy and vitality hormone, and this is a hormone that is, when you're, by the time you're 45, is half of what it was when you were 25. And so it's important for immunity, blood sugar regulation, energy, and vitality. So I think it's probably one of the most important hormones that we use that help people feel better. Melatonin we use to help kind of orchestrate all the other hormones. It also has antioxidant and anti-cancer properties. And then vitamin D is actually a hormone, it's not a vitamin, and its structure is very much like the structure of the hormones that I showed you. And so vitamin D is involved in 400 different processes in your body, and it has to do with your energy, your mood, your weight, your cancer fighting ability, your autoimmune fighting ability. Vitamin D is really important. So those are all the things that we use. And the benefits that we see, and you know, I just had somebody, actually I talked at the Rotary Club, and one of the people, she became a patient, she's like, I'm so relieved, I thought I was gonna have to live like that the rest of my life, you know, her energy was down, her moods weren't good, she wasn't sleeping well, all that's like pretty typical, you know, so you don't, that was what Amanda was saying, like the light at the end of the tunnel, you don't have to live with all of that. And so these are some of the things that we see that people benefit from. Progesterone is very brain calming, and we call it nature's Valium. It helps your mental focus, it decreases irritability, it helps you sleep, it makes you feel calm. So a lot of like the turmoil that you go through in perimenopause has to do with your progesterone levels decreasing or being very erratic. And it also does a number of other things. It helps with migraine headaches, and for women who are still in the menstrual cycle part of their lives, it can help PMS. That's one of the hormone changes that during that up and down cycling during menstrual periods causes premenstrual syndrome. And estrogen, people, you know, I think it came from chickens. People are always worried. They hear about chickens getting hormones to fatten them up, which they do, but interpret it for humans, thinking that you're going to get fattened up. And what happens when you're on estrogen is it actually does help you maintain your hip-waist ratio. It helps you keep from going through that body composition change that happens during perimenopause. It maintains your lean body mass and reduces your mid-abdomen and visceral fat. So, and it also improves your insulin resistance and makes you less likely to have diabetes. So a lot of things that people worry about based on chickens, you know, capons and things don't apply to humans. And this is one of those observational studies, so you know, you have to take it with understanding. But what they found was there were fewer deaths in estrogen users than in non-estrogen users. And the criticism that people have of these observational studies is maybe the women on estrogen were people who were more proactive about their health, not only in terms of getting on hormones, but maybe exercise and sleep and all the other things that we know play a role in maintaining your health and preventing premature death. So that's the thing we never know about these observational studies. But certainly when people are worried about being on estrogen, it does not make you die sooner. If anything, it helps you live longer. And yeah, significant reduction, 40 to 50% reduction in cardiovascular disease in women who are on estrogen. And let's see. So women who are not having any cognition problems and memory's fine may not notice a change when they're on estrogen. But women who are having some memory problems, some brain fog, some confusion, not able to like multitask like they used to, they did show an improvement with being on estrogen. So if you're good, it doesn't necessarily add to it, but if you're having problems, it can help. That's the upshot of the slide. And then testosterone, I talked about the benefits in terms of libido, muscle mass, energy, cognition, applies to women as well as men. And then, like I said, these are the things ultimately that I see when people feel better, you know, when you can get through your day and you don't feel like it's a struggle. And I have people say, you know, like I have these to-do lists I never get through. I do what I have to do, but then I don't do any more. I go home from work and I crash at night and I don't do things I enjoy because I don't have the energy. I just do what I have to do to get through the day, you know, just kind of basically surviving rather than thriving. And so those are the things that I see as benefits of people being on both hormones, men and women both. I'm happy to take questions. So maybe we should turn this off. Oh, no one ever started it? Do we not push it?
Do we not? I thought we pushed it. Right,
It
kids?
says start live stream video.
I got a notification that we started.
From us or from
We have
Amanda?
Oh,
We
yeah.
have one.
that
I
was-
have it so I can still send you the video.
Okay.
Oh.
Yeah, because I sent out a message to my list. I thought somebody had pushed it.
I thought he pushed it. One of us. Yeah, well. It was Steve's fault.
Brain fog.
It was Steve's
We're
fault.
recording.
We got it. Please send it to
recording,
you to post.
and you can let everybody know that.
Yeah, we have a fully, not just the live, but we have a recorded version too.
Great.
Yeah.
Yeah, I'll send the link. Yeah. Do you have any questions?
So I have
So, I don't feel like anything. So, is it still a benefit to add estrogen back into?
Yeah, that's a really good question. I don't think everybody has to be on hormones. I think it really depends on what your family history is like, what your risk is for disease. If you said all of that, but then said, my mother and grandmother had Alzheimer's, I would say even though you feel good, it probably should be on estrogen. So it really,
Hopefully I take after my mother because she was
Pardon?
94.
What?
I said hopefully I take after my mother because she died when she was 94 and was
Yeah.
it was just the shutdown really of her body as opposed to her
Well, incredible, right. So that's why I'm saying it really,
It just depends on the person.
Yeah, it does. And so if you feel good and you don't have any particular risk,
Okay.
I'm not sure you need to be on hormones.
Mhm.
So it just needs to be evaluated
Yeah.
separately for each person. Yeah.
So what about, if taking hormones orally isn't great, what about the pill versus an IUD or some other form of birth
That's what
control?
I'm saying. For contraception purposes, you really have to make your choice based on what works best for you. And every form of contraception has its pros and cons. IUDs have risk of infection. Birth control pills have risk, although it's very small, of blood clots. Other things that are safer as far as serious risk have increased risk of pregnancy. So it really, everybody's got to
It's not
take
as
their
cut
choice.
and dry.
Right, yeah. I mean, if it's super important not to get pregnant, then you may not want to use foam and condoms or diaphragm. You may want to use, something like an IUD. If it's like not such a big deal if you were to get pregnant, then you use barrier contraception and don't worry about the risk of blood clots or infection. So it really depends on everybody's particular situation.
Does that form of estrogen change in the liver and become more like the
It does.
ketones form?
Right, so it's synthetic estrogen that's in birth control pills, but it does go through, first pass through the liver, so it increases clotting, and that's why women on birth control pills have an increased risk of pulmonary emboli and blood clots in their legs, although, like I said, because of the population, because it's generally a younger population that's on birth control pills, it doesn't happen very often, because that younger population, blood vessels are in better shape, so less plaque and things for clots to accumulate on. Yes.
So I have endometriosis, and I've just been on birth control basically since I was in my early 20s for it, and that's all doctors have been able to
Right.
give me for it, really. So I've tried multiple kinds of birth control. They all suck, but I've tried them, and I've switched around between them. Do you know? Because I've never been given any other options. Do you know if it would be beneficial to get more on something that's just like a hormonal treatment versus birth control to treat it?
Right, so women with things like endometriosis and fibroids are what we call estrogen dominant. You have more estrogen than, your body is balancing it out. And so the approach is to do a number of different things. One is to balance it with progesterone, so that's one approach.
That's the one that's in my arm. That's what it releases.
Okay, so that's why they're doing that. The other is to be sure and remove everything in your environment that can be an endocrine disruptor, which is all the plastics,
Really?
body products,
Wow.
that have parabens, and because those act like estrogen in your body, but not in a good way.
Oh,
And
wow.
so we think that's one reason why women are what we call estrogen dominant, is because of all the environmental toxins that act like estrogens in our body.
Okay.
So not drinking water out of plastic bottles.
Is something like the aluminum okay? That's what I use.
Right, so people have concerns about aluminum, and is that aluminum or some other metal?
It's aluminum, I believe, in there. Is what I
Okay, because people are worried about aluminum and Alzheimer's.
So maybe glass is what I should be.
Probably glass is the most inert.
Okay.
But even the bottles that say PCB free, they have some other plasticizer in them. So I'm not sure that they're, really the safest alternative. Probably glass is the best. And then body products have a lot of endocrine disrupting chemicals. Pesticides are endocrine disruptors, so eating organic. The hormones that are in beef and chicken are endocrine disrupting. And then for some women, not properly breaking down estrogen. And so that's something that regular doctors don't test for, but we test for in functional medicine, is seeing how you metabolize it. And if you metabolize it to certain metabolites that are more likely to cause endometriosis, they are more estrogenic. Then there are things that can be done to change the metabolism by using supplements.
Oh, where can
Yeah.
I go to do more testing like that versus like?
To her.
Yeah, we do that, yeah,
Oh, so just, okay,
yeah. Oh, yeah, I didn't bring it, I have some cards and stuff.
I can send her information out too, but we can get, yeah. She's got-
Only moment.
Good
Are there
test.
natural, forms of, like, can you eat estrogen, or is there like a plant or something that you can ingest and
That will have an estrogen effect. Not really. People will try to use black cohosh for things like hot flashes, and it's not clear that it works any better than placebo. So, yeah, it's hard to get these things through food. It's even hard to get vitamin D through food. You can get it through sunlight, but unless it's vitamin D fortified milk or something, it's hard to get it through food.
So when you get things like this, like supplements, that I've seen them say like phytoestrogen and stuff like that.
Right, so those are herbs that are claimed to have similar effects to estrogen, like black cohosh.
But they still process through the liver and give you that bad outcome.
They won't, no,
No.
they won't, because they're not estrogen.
Oh,
But they work, like I said, kind of 50-50. It's not, it's not clear whether it's placebo effect or they really do something.
but they're not necessarily causing any harm?
No,
Okay.
no, they wouldn't cause blood clots.
They don't?
No. The estrogen, there is progesterone cream that can be sold over the counter that really is progesterone. And that has helped some people with PMS. It's very low amounts. It's able to be sold over the counter, not as a prescription. But any estrogen, progesterone, or higher doses, estrogen, testosterone, or higher doses of progesterone have to be a prescription. So if it says estrogen and it's at Whole Foods, it's not estrogen. They're claiming that it has some maybe estrogen-like effects, but it can't be estrogen.
Okay.
Yeah.
Do you have a preference of a patch versus estrogen topical cream?
I don't. I think, it's what works most comfortably for you. For some people with cognition problems, being on the patch, which keeps a more level estrogen level, more even estrogen level, works better for their cognition. For people that are very sensitive to changes in estrogen, even applying it once a day and then their estrogen level goes down by the next day, for sensitive people can be enough to make their cognition go down. But that's unusual. So for the average person who's getting relief from or prevention with estrogen, I think any of those forms are fine. There are sprays, there are gels, there are commercially available patches that are commercially available. There compounding pharmacies make creams and gels. So there are a lot of different ways to get it. As long as it's estradiol and or estriol and it's in a topical, goes through your skin. It's the most important thing.
Do you do blood testing? Is that how you figure out what?
We do blood testing. We do blood testing to check hormone levels, and then there's urine testing to test these different metabolites. We're trying to figure out how somebody's breaking down their hormones. We use urine testing. Yeah, and some places use saliva testing. I haven't found that to be helpful, but there are doctors. It's kind of whatever the practitioner is most comfortable with and has experience with and can correlate with like how your patients feel is the best thing to use. And so there are doctors who use 24-hour urine collections to test for hormones. I just feel like that's a lot asking somebody to do quarterly. I mean, it's really a hassle doing 24-hour urine collection. But yeah, we use serum, we use blood tests, except for looking at the metabolites. That has to be done in urine. And we don't use a 24-hour urine collection. We use another spot urine.
You mentioned about the migraine, so my sister had to leave, but she and I both, we've always had headaches, which I also think is hormone related, but then since going through menopause, we've gotten, she gets them way more. She's actually on a migraine study right now, so I get them way less frequently, but I do think it's related to hormones, and so I was interested in, like, can you talk about that a little bit? Like,
Sure.
What is that, because that would be, because I'm one of those people who believed all the other study. I don't like to take stuff. I don't even like taking Imitrex when I have a migraine, but so I believed all the breast cancer and the things about the hormones. So what you say makes a lot of sense because I just don't like to take stuff. I like to work out and eat healthy and do that more.
Yeah,
So,
fantastic.
can you talk a little bit about the
Sure.
relation?
So what seems to happen with migraines is the worst thing for migraines are changes in hormone levels. And so we very typically will see people who are in the menstrual reproductive phase of their lives, and a week before their period, when estrogen goes down, unless you've gotten pregnant, a migraine will get triggered. And a lot what I would see is women who, with peri-menopause, because then the estrogen gets a lot more erratic, and you can't count on it being about once a month. It could be multiple times a month estrogen's changing. Is I would give very small amounts of estrogen to kind of fill in the gaps, not to significantly raise the level overall, but just to be there for when the level drops way down, not have it drop so far down. And that I found to be helpful for women who get migraines triggered by the hormonal cycling with their periods. Progesterone also, it probably plays a role in it, because progesterone levels decrease about a week before a period starts, unless you're pregnant. And so also filling in with progesterone. And so what I've observed with women with migraines in menopause is some women feel better once the ups and downs stop. Even though their hormone levels are low, not having these varying levels really improves things. I've seen other women who, when it's low like that, it's migraines all the time.
Probably my sister.
It might be, yeah. And migraines are very complex. I mean, I would say it's one of the things we're not the most successful at relieving. Like all the other, like menopause and all that, like your energy, your libido, your moods, all of that, that's really fixable. Migraines are so complicated. They can be due to food allergies and sensitivities. They can be due to environmental factors, stress factors. It's like an electrical storm in your brain. It is a very big event, and hormones play a role. And I think for some women, it's been a relatively easy fix to go on hormones. But I've had other people who just continue to get, every few days bad migraines. But if for your sister, if things got worse with menopause, she might want to look into just starting like very low dose and seeing if that will decrease the frequency or the intensity, and just stay on a steady dose as possible. So for somebody like her, you would want a patch where it doesn't even go up and down in a 24-hour period. Like the patches you change twice a week, so it stays pretty level for a few days and it goes down and you put a new patch on. But something like that might be helpful to her and for her. And we use other things too. We use CoQ10 can be helpful for migraines, and fish oil, vitamin B6.
She's tried so many things.
Yeah, the people with really bad migraines have usually tried it all. But if she hasn't tried hormones, a very low dose might be helpful.
That's the one thing she hasn't tried.
Yeah, she might want to try it in a patch. Yeah, they make the patch in tiny doses.
Okay.
Yeah.
Interesting.
Are we okay as far as time? Hopefully.
I have a question about the study. So if the study was done 17 years ago, is there a new study happening?
There are new studies all the time. They don't get publicized because they don't have horrible news. So, yeah. So there are lots of studies that show benefits or show no increased risk of cancer. There's a huge study in France, 10,000 women using bioidentical hormones, no increased risk of breast cancer. You didn't hear about that study.
That's terrible though, but that's big pharma. I think big pharma is a lot to
Yeah, because if it's not going to push
Problems
some.
with a lot of
Yeah, that and the media.
Yeah.
And media,
Yeah.
I know, every time someone says, oh, there was a hormone article in the paper and it showed blah, blah, blah risk, I'm just like, oh, I know, so women's health initiative again. Of course, the newspaper doesn't say it, and I have to go like looking up the backstory, and then sure enough, it's not a new study.
Well, I've definitely been one of those people who believe that and read that, because again, I don't like to take stuff, then you read that and you're like, oh, no thanks.
Right, another reason, there was one positive article in the newspaper by this doctor, his name was wrong, he's actually an oncologist, and he feels that estrogen is beneficial for women. and I sent out a blog post, it was last year, and I said like, finally, a positive article in the newspaper. It was one article, you know, boom, and then it was gone. I think it was in the LA Times, it was like an op-ed kind of thing. But yeah, he's an oncologist who's like, he's written about hormones for 20 years.
So, my doctor I've had for 20 years told me to just write it out.
Right.
And
See you, ma'am.
I don't want to. I'm over it. I'm over like everything you've explained, I'm experiencing.
Oh,
Like,
wow.
I mean, a little bit of brain fog, the like changes in my body, like across the board. And my mom had cancer when I was young and had a full hysterectomy. She had cancer in the uterus, full hysterectomy, and then went on to have Alzheimer's. Back then, I remember reading articles about hormone replacement. She never had hormone replacement back then because that was, 30 years ago, and things were, not enough information, hard to get information. So I always wondered if her Alzheimer's was linked to the low hormone.
How old was she when she had the hysterectomy?
Young. She was like late 40, probably 40.
Wow.
And then she had Alzheimer's, got early onset Alzheimer's in her 50s and had it until she passed away in her 70s. So
It could have been
avoid that.
related. You know, Alzheimer's is not just due to one thing, it
Yes.
has multiple
I
causes,
understand, yeah.
but that certainly could have played a
It
role.
was a concern back then, does she get hormone replacement, yes or no? I remember that, we're trying to decide what to do, but there was so much negative about hormone replacement at that time, so.
Right, and then there sometimes is, depending on the type of uterine cancer, a concern about, because that is an estrogen-dependent cancer, about whether you would increase the risk of recurrence. So it depends like what stage it was it very confined or not.
Yeah.
But it may have played a role. And somebody with, when I got into anti-aging medicine, so I got into it from gynecology, where, I had given women estrogen for their hot flashes and stuff like that. And then I started learning a lot more about hormones and what hormones do for our bodies, not just for relieving symptoms. And I had women say, my memory's better, I'm remembering things more, I don't have to make so many lists and stuff. I thought, that's great, maybe it's because they're getting more sleep now, and they have more energy, and they're not as stressed, which is not good for brain function. And then as I got into really specifically focusing on cognition, I thought, wow, I'm not just relieving people's symptoms and making them feel better. I am really impacting women's long-term health and men's too, and including cognition. So writing it out, why would you do that?
I don't want to anymore.
Unless there was a serious risk, and there is not.
And I agree. I have this mentality where I try to be really healthy. I exercise all the time, take care of myself physically and mentally, and sleep and food and everything. And so I hate to take things, but there's benefits to taking things. But I want to understand the right way. So I don't think we should have to write it out. It's miserable.
Right.
It's not comfortable. If we can feel 20, 30% better, and it's good for our body and not bad for our body, why not?
Yeah, right. I would say it's good for your body in the long run. There's no downside.
Yeah.
And
we're living longer, right?
we're living longer, but we have not decreased the span of debility at the ends of our lives. So we have not diminished that 20 to 30 years of disability at the ends of our lives. And that's really, we're lifestyle,
Yeah.
hormones,
Yeah.
like everything that you're doing, you'd feel a lot worse if you weren't doing it. This is what I've observed. The women that come to see me who they're eating well and they're sleeping and they're working out with Amanda and taking care of themselves with stress reduction and still don't feel good. It's just like that hormones are like the missing piece.
Yeah.
You'd be in a lot worse shape, and you would have been in a lot worse shape a lot earlier in life if you hadn't been doing that. So it's not that, that's very beneficial. It's just like there's a missing piece of the puzzle.
Yeah.
Yeah,
And-
Amanda
and-
sees Dr. Sklar.
And
She does all the right things plus.
yeah, and people like yourself that are doing everything usually respond really quickly, feel better right away. This other lady I was telling you about from the Rotary, she does all of that, was still just, her energy was terrible, and she plans like all these conferences, and she's very active volunteering, and was like barely scraping through, but doing all the rest of it, and it's like in the first month, she was like, I tell you, I feel a lot better. And yeah, that's what she said, I'm so glad I didn't have to live like that the rest of my life.
Yeah, that's how I feel too, because I mean, for me, I have a really stressful job, and I've always been super high energy. I look back, like, my family will show like home movies, and I'm like, oh, like I'm never standing still, and people are like, how do you have so much energy? But I can tell myself, I'm not sleeping very well, I'm really tired. I still have a lot of energy compared to most people, but it's not me. And I feel tired, and I feel like I get home from work, and I'm just like, I don't wanna, I'm just done, I'm fried. And that is not me, for sure. So, and I do all those other things, but, I mean, I'm definitely not.
Yeah. You know, I have that number people can text if,
Yeah.
let me see if I have it in my phone. I usually make a slide of it, and I forgot to do
I have
that.
a few of the flyers back here too, but I'll
Yeah.
give the number for sure, cause
We have a number you can text if you want like a copy of the slideshow, or you want a free consult.
one flyer.
Let's see if I can, I was supposed to have a slide up about it.
But
Yeah, if you, write this phone number down, 562-280. Oh, okay, 562-280-2191. And that sends us an email message, and if you give us your name and email address and just say, I'd like a copy of the slides, or I'd like to be on your email list, or I'd like a free consult, we'll get back to you next week. So it's a really easy way to do it.
I had one question about the testosterone, for that. What's the best way for guys to ingest it? Is it like a patch?
It should
pill?
be topical or a patch.
So same thing, right?
So the thing with testosterone is, testosterone gets broken down. If you take natural testosterone by mouth, it gets broken down and it's ineffective. So they end up needing to make a synthetic testosterone. And those synthetic testosterone are very bad for your health, cause liver cancer and a lot of other problems. So it's not quite, it's a risk for being on oral, but because it's these really bad synthetic ones. You can't take testosterone, natural testosterone in oral form, it gets broken down.
Oh, so
Not
all it is like
effective. So
testosterone
it's gotta be done as a
supplements
patch, and there aren't patches for women, that there are patches, men, when they get testosterone replaced, it's about 100 times higher amount than women get.
Wow.
And so there are patches out for men, but you can't like cut them apart or anything for women, they're like way too potent. So we have a compounding pharmacy, and they make up gels and creams,
Okay.
but it has to be on the skin, can't be taken by mouth. And that goes for men also.
So
Men have
many
to use-
testosterone supplements out there, so.
Well, there are, and a lot of the supplements are things like amino acids, which will build up human growth hormone, and I think the amino acids get promoted for building testosterone. I think they do.
Yeah,
Yeah,
I think they do. Yeah, because, well, it depends if you're training. You have
Right.
to actually train, use your, right?
and use the amino acids.
Yeah, and,
Yeah. But yeah, the same thing goes, none of the supplements actually have testosterone in them, it has to be a prescription. And it not only is a prescription, it's a Schedule 2, meaning it's treated as a narcotic. Like, they keep very close track, I have to report every month who's on testosterone and verify.
In case you're weightlifting competitions or an athlete.
Wow.
Ooh.
What about competition?
So if a 30-year-old comes to you and tells you they have low testosterone, but don't bother testing them, they're an athlete.
Yeah, I don't,
I think that's
I
why.
don't treat people who are